Let's talk a little bit, first of all, then about how has the profession of nursing changed for you over this period of time you've been working in it? What are the big changes you've seen?
Well, one of the things that really concerns me and why I didn't go back into the hospital is there is really no nursing care. There's no time allotment for nursing care. It's all mostly administration and keeping up with the flow of admissions and discharges. And that really does concern me, possibly from a personal point of view, that someday I may need that. And compared to the way we used to give care, it just isn't there. And I hear it many, many times with my own clients in the postpartum community.
Let's talk a little bit about that. Is a number of people have commented on this increased acuity in any of the hospital situations. People are out. And an example often given is postpartum. So, whereas it used to be a week, God knows, way back, it used to be 2 weeks. Now it's, out they come and out you go. Is
That's
that
right.
what you're experiencing?
And with young moms, some of them are quite happy about that. I would probably say a majority of them are quite happy about that. My question that arises from those comments is, what is the environment like for them within the hospital that has them want to get out so quickly? My assumption on that is there's just not the care and caregiving and maybe even the celebration of the birth and the family and that sort of thing. And I don't think it's because nurses don't care. I think it's because there's just no time to do that.
Well, a number of people used to talk about part of the job definition of being a nurse was the teaching aspect of it, that once the patient was kind of an acceptable kind of health level, then the next phase was that you were preparing them for what they were going to be doing outside of the hospital. It sounds like that's missing. Is that your perception?
There's an attempt at teaching in the area that I'm working in. There is a definite attempt in our program to be able to teach moms what they would be interested in knowing as they go out into the community. I think they're too tired. They're in too much of a recovery state for any of it to really stick. So as much as I think that we're doing it in hospital, we find in community that we have to repeat it a lot because they don't remember. The human being is often very tired after an extremely physical exertion like childbirth, and I just don't think they can retain it.
Yeah, I think that's the point, is it used to, you didn't even start to talk about this stuff till 48,
That's right.
50, 60 hours later, Again.
Yeah.
So, do you see any way that the union or any way that the system can be changed to alter that kind of out the door mentality?
Oh, well, ideally, I really would like to see a woman-child facility that also includes family. I know they've done it in various places in the world. I understand even in Australia, now I'm not sure if it's in the public health delivery system there or private, because I understand they have both, that they have the policies are that mothers and babies stay in for 5 to 7 days. They wouldn't probably need all of our services in community if we had mothers and babies stay in for 5 to 7 days. But I think what it gives them in a situation like that, where there's a bit of more rooming in and assistance at the beck and call down the hall, that it gives them a little more of an opportunity to relax and get into being familiar with their new responsibilities. So here, wouldn't it be nice if we could have a facility like that for babies and mothers and fathers and families where they could come and go and get used to the new infant and not have to go through a hospital that has a number of different ailments, you might say, that may possibly be, you know, a compromised environment for toddlers that are in the family or even the adults themselves. I mean, our delivery system for childbirth is within the active treatment system. And, you know, I even say to the moms that come back in a follow-up clinic appointment, stay away from the urgent care area, just because I think it's a healthier way to bring them into a follow-up appointment.
Oh, that's totally true. I mean,
I don't have to be too serious about this, but
no,
those are
but
just my ideas.